Well, welcome everybody. My name is Christopher Chillens. I'm the Dean of Georgetown College. I'm here pinch hitting, as it were, for my very good friend and colleague, Paul Almeida, who's the Dean of our business school. And I'm really happy to be here just to kick things off. This panel is entitled The Promise and Perils of Contact Tracing Technologies. And I have to say, I can't think of a more timely topic. I think probably like a lot of you, about 6 months ago, I don't know that I thought too much, if at all, about contact tracing. And now I think we're thinking about it as we're thinking about a lot of other things in this new era that we're in. I think on the one hand, we realize that contact tracing is absolutely essential to keep us healthy. And yet on the other hand, we think a lot about protecting our privacy and making sure that our own data stay integral and our own presence and whereabouts and so on. So, it's an interesting topic. It's a meaningful topic. It's controversial. It's got the excitement of new technologies. And I just think this is going to be a very exciting panel. And I guess what I'm really happy about is to be able to introduce our esteemed moderator, Miles O'Brien. And I'm very proud to say that Miles is a 1981 graduate of Georgetown College. And he's come back to moderate this panel. Miles is, I think, a presence, a face, and a voice you're going to have seen in many different contexts. He is the science correspondent for the PBS NewsHour. He's a producer and director for the PBS documentary series Nova. He's a correspondent for the PBS series Frontline, as well as the National Science Foundation Science Nation series. He studied history at the college, and I know he brings that broad liberal arts sensibility to everything he's done. I think, Miles, we're just so honored that you're here with us today at Georgetown and being willing to moderate this conversation. Miles is going to introduce the rest of the panelists to you. I will note that Miles has said, and I quote, he likes his beat because it offers solutions. And I think that's a great way to think about the wonderful work you've done, Miles, and the sensibility you've been willing to bring here to this conversation. And on behalf of Georgetown, I thank you for it. And so let me just before I close, thank very sincerely the Alumni Association for their wonderful partnership and everything they do and helping put this together. And of course, thanks to all of you in the audience who are here and will be both listening and will be eventual participants in what I know is going to be a very, very invigorating conversation. So that's it for me, folks. I'm gonna pass it off to Miles, and I wish you all the very best.
Dean Chillens, thank you so much. You have exposed my imposter syndrome issues. I'm the history major from Georgetown that covers science. I guess I'm the poster child for liberal arts, right? I mean, it's first and foremost learn to read, think, and write, right? And the rest comes after that, right?
You can do anything with a liberal arts education, very true.
Absolutely. Well, I'm proud to say Georgetown is where I received my liberal arts education. And, a lot of people come to me and they have, over the years, many interns and aspiring journalists, and they ask me what to study and where to study. And I always tell them, don't study journalism. I tell them, it's much more important. Go to get an English degree. Go learn how to think first. And you can learn the vocational stuff later. And you can end up learning a lot of things about science, as I did, which was a surprising career turn for me. But that's not why we're here today. A few years ago, I was in Sierra Leone covering the Ebola crisis there. And that was my first exposure to this idea of contact tracing. And it was used so effectively there to identify cases and, put a ring around those cases and figure out how to contain a fast-moving virus as it ripped through the populations over there. Ultimately, it played a big part in tamping that outbreak down. And as we are in the middle of this historic pandemic, the subject has come up as we consider ways for us to get back to some level of normalcy. As we speak today, there are virtual tumbleweeds rolling through the campus on the hilltop because we can't be back to normal. And unfortunately, I think through the first 6 months of this, we've had this kind of binary discussion. Either we're closed or we're open. Either we have the bars raging or we're shut down and at home. But there's a lot of stuff in between that we can and should be thinking about that can ease us back into our way of life and going back to school and being at school in a normal way, or going back to work, or doing the things we all love as part of a normal life, even as we try to put the virus at bay. Yes, we need a vaccine, but these things are important as well. And so contact tracing is a part of that. Wearing masks is a part of that. Social distancing is a part of that. Just being prudent in the way we travel. There's a lot of things that we can do to pile up layers of safety, which can stem this spread. But contact tracing is really at the core. If you look at the places in the world that have really gotten a hold of this, Singapore comes to mind, Switzerland, other places, there's a key component in this of contact tracing, which is, essentially identifying a case, and what we're going to get into more detail this, but finding out who that person has been in contact with, reaching out to those people, instituting quarantines, and hopefully stopping things before that exponential spread takes off. So we have a great panel here to explain what it is, what technology might do to help it, what are the potential pitfalls and all of that as well. That is in the title or perils, I should say, that is in the title of the program. And what are the issues of privacy, and how can we really truly use this as a way to get back to work, and also protect this data, which might be out there. So I'm going to run through quick introductions. You guys can Google around and get further. These people are way too, I could read their CVs and we'd be done with the hour, so that would be it. So Catherine Lotrionte is the founder and former director of the CyberProject at Georgetown. She's a senior associate technology policy program at the Center for Strategic and International Studies, among other things. Alexandra Phelan is the assistant professor at the Center for Global Health Science and Security at Georgetown School of Medicine, and she's an adjunct professor of law at Georgetown University. Double threat there. Lisa Singh is a professor of computer science at Georgetown and a research professor at the Massive Data Institute McCourt School of Public Policy at Georgetown. And Jason Sletcher is an associate professor of accounting at the McDonough School of Business at Georgetown. It's great to have you all with us. And I'll tell you what, I'd like to begin with Alexandra if I could. And let's not assume. Sometimes we jump on the moving train sometimes on these discussions. I think it's worth, I think we all have some idea what contact tracing is, but I think it's worth just a little bit of 101 on this, 101 level course on what contact tracing is, taking aside the technology component. The contact tracing is as old as epidemiology itself. What exactly is the notion behind it?
Yeah, so contact tracing is a public health technique to stop transmission of an infectious disease. So first you start with someone who has been infected. You then interview them to identify other people that they may have come into contact with and possibly exposed to the pathogen. You then contact those people by phone, call, email, even social media, and inform them that they may have been exposed without identifying the individual who may have infected them. And contacts are informed of the risks, the potential risks of the infectious disease, and educated about the symptoms, that they can first quarantine themselves and monitor their health for further illness, with the idea that that then prevents transmission, that they may then spread transmission if they're being infected. The aim is really to do this fast enough and comprehensively enough that you break the chain of transmission in the community. And that's why it comes back down to those 3 T's, the test, that you really rely on rapid and quality turnaround of tests to identify cases to start the contact tracing, then the tracing process to identify the contacts, and then isolating and support, so to prevent that further transmission. So it's all part of this comprehensive strategy, and contact tracing is really central to that.
So without rapid and cheap testing, it's kind of a waste of time. That's a linked issue, correct?
Absolutely, because if you're not getting the positive test fast enough to identify your sort of first point of call to start tracing from there, then by the time you've identified, it could be a week later, and that's a huge number of contacts, pretty much close to impossible to try and cover if somebody has not been at home and self-isolating or sort of self-quarantine already because of lockdowns or other restrictions.
As I understand it, it's important to do this at the right time in the crescendo of a pandemic. If a pandemic is raging way out of control, it's not practical to use it. Is that accurate to say?
And so it becomes much, much harder because when you've got that exponential growth, the number of people that you need to contact, that chain then continues on. So it's not just that first person who you've identified as being infected. And it's when you have unknown transmission chains that things can really start to get out of control. And even if we look at, say, Melbourne, Australia, where there is an ongoing epidemic at the moment, very small in comparison to the United States. And even there, that's at a scale where contact tracing has been really, really difficult and challenging. So absolutely, the timeliness is so critical to getting in front of that exponential growth.
So there are places in the United States right now where it would be appropriate to do this in a concerted way, I imagine, right?
So I think that's what we're seeing with a lot of universities as well. When you've got this more closed environments, that potentially you've got the ability to engage in contact tracing, but that's much harder when we're dealing with, say, more college communities outside of the university itself, or in cities or towns where you have that spread happening. But certainly there would be places where this contact tracing process is still really integral to identifying cases and stopping local transmission with other public health strategies.
So Lisa, let's talk a little bit about how technology can come into play here, because I can imagine, God forbid, I tested positive and I get a call from the contact tracer and they say, okay, so who have you seen over the past 2 weeks or whatever the number is? I barely know where I was yesterday. So I know there's a lot of technology that's being explored out there, and it's very controversial and hasn't really been spooled up in a meaningful way in this country. In some other countries it has. And I also know that you've looked at using social media as a means to do this. What are the technological tools that could be used to make this a more efficient and accurate process?
So thanks. That's a great question. And what we need to, if we're going to use technology, we have to use technology that people are surrounded by. And in different cultures, that's different types of technology. So in our culture, mobile phone, our phones are the biggest, easiest way to connect people. We tend to carry them everywhere. I actually don't carry my phone, and my children get angry at me that they can't get in contact with me every moment of the day. But most people do carry their phones, and they're smartphones also. So we have a community where smartphones are very popular. And so if you have a technology that your population uses extensively, that's where you want to start. And then you want to see if within that technology you can very easily identify other individuals who are close by. And that's a very tricky thing to do, and that's where a lot of the technology breakdown has been, where people may use something like Bluetooth technology or other types of technology that you have to, if you're not within a certain distance, it's sometimes unclear whether or not someone is close by. And then, so things, other types of technologies other than phones that could be useful could be things like Fitbits and other types of technologies that use Bluetooth. And then finally, in places where people don't carry devices around, that's an opportunity to look at things like social media and other types of online forums where people participate and are communicating in a different way. Maybe even if they only communicate in that way 1 or 2 times a day, that still gives us some idea of potentially where they've been. So there's no one answer to this technology question. It's very community-based, but because mobile phones are so prevalent, it is a natural starting point, assuming you consider privacy and other types of issues that are there.
So I do know that Apple and Google actually got together, which is what, like what, from Miracle on 34th Street, Macy's and Gimbels are together. It's like a big deal, right? To make an API, which is the underlying idea behind the software for states to use to come up with this software. And there are all kinds of assurances that their privacy would be protected. And for some reason, people, when they hear the name Google, think maybe they won't be so protective of my privacy. So there's a fundamental distrust of this idea. Lisa, and I'm not sure that people have gotten over it yet. What are your thoughts on how that might occur?
Yeah. So I'm with the public in not wanting to trust large tech companies. Okay, they have abused our data in many ways over the years, and we you know, our data hasn't been protected and has been sold, but we're in the middle of a crisis, and these large tech companies have resources that those of us at universities who might be trying to build technologies or think through different research ideas may not have access to. And they're getting pressure from research communities to build technologies that think about privacy and that think about standards that can be met internationally. And I think that's really, really important here. We need to hold these companies to these standards of requiring high levels of privacy. So in the case of Apple and Google, what they've done is they've come up with a cryptographic solution that uses pseudo-random numbers to kind of help keep people's identity as private as possible. Is it, you know, totally perfect? Probably not. No, I haven't walked through all the specs of everything, but on the surface, they're trying very hard to keep people's privacy. So there's this trade-off. The nice thing about their technology is they're not maintaining any of this data themselves, and there is no long-term maintenance of the data either by any state. And so I think that also is really important in the design, and it's really important as a consumer. We have to kind of have some faith that you know, when the data is gone, it's gone, and while people have it, they're using it responsibly. So all of your information about where you are and the way that it's stored on your computer, on your device, it can't be linked to you personally on any other device. So that's a really important notion. People don't know who you are in this technology that's being used.
So the data stays local, doesn't get put on a server, and as I understand it, it has a sunset. It goes away after a certain period of time. Exactly. People still hang on to their wallet when they hear you know, claims like that, right? So it seems to me, you know, would it be appropriate for some sort of independent group to be in the middle of this, not just Google, trying to preside over this to give people a little more sense of that this is something that would not be used against them in some fashion?
Yeah, so I will give Google and Apple a little bit of credit here. They have posted all of their standards online, and they have posted the basics of some of the code. So I believe it is their intent to make sure that the research community actually tries to break it. And I think that's a really important aspect of this, is to work together with the research community as well. And if that isn't highlighted, if people aren't able to look at the code and to walk through it and to audit it, then we should all be concerned. That should upset us. But as long as these audit trails exist and researchers can continue to collaborate with them to improve the technology, I think that's really important. Google's also giving the technology to the states, and the states are supposed to kind of create their own version of it and to build the applications above it and be in charge of it. That's been really hard for states. Many of the states have failed at this, but I do think that they're trying not to be, you know, the middle person, the person that owns everything underneath, and they're trying to be better citizens about this because they realize the importance of doing this rapidly.
Well, we'll get back to some of those issues. It's kind of fascinating how concerned people can be, and rightly so. And I should point out to those of you out there, and thank you for being with us today, by the way. We invite you to participate. Send your questions or comments. Put them into the questions section on the GoToWebinar control panel, and those are just going to funnel to me magically. And guess what? It'll be completely anonymous. I won't know who you are. So there you go. And then after this is over, I'm going to delete that folder, so you don't have to worry a bit. All right. So Catherine, I want to ask you, give me the big picture. What I've read just reading in for this particular segment is, like so many things in response to COVID-19, the U.S. is very disparate. There's not a lot of consolidated central guidance or leadership. Each state is sort of on its own. Everybody has their own approach to this, which of course makes it very difficult to come up with an effective contact tracing scheme. Why don't you just give us the big picture on what the US is and is not doing and how that compares perhaps to other countries who might be doing better?
So you're right. The U.S. has taken an approach which is quite, decentralized. The federal government does not have a contact tracing strategy. In fact, according to the National Association of, I think it's council, city and county health medical professionals, there's no specific federal funding that's been designated for contact tracing itself. So the federal government's left it up to the states to determine how they're going to build a program for contact tracing and how they're going to pay for that contact tracing, and including both using any new technological tools that they can implement. So even in the traditional contact tracers, the individuals, states there's dramatic differences. I think if you, on the scorecards, I think the state of California and Washington and Massachusetts have been getting some of the best kind of reported actions that they've taken in terms of the number of individuals they've hired as contact tracers. So that's an indication. And I think that the statistics that I've seen in studies, they said for the United States, for the number of COVID cases that the country has, and I guess as of today, I was looking at it, we've got, I think, 6.46 million cases and 194,000 deaths. For those statistics, we should have about 100,000 contact tracers and the physical people going out and doing this work. And we don't have near that. And, in a city, I mean, New York also has gotten some good records because they went out and they've hired, I think one of the states, they took librarians and they started training them to be contact tracers. The education required is not very extensive. You can train them. A lot of it is in the medical profession. You have to have a rapport with people. You have to be sensitive to cultural and language barriers. You're going to be knocking on people's doors. You need to be empathetic and you need to offer services. And so our country is clearly lagging. Some of the other countries that have been ahead of the ball, both in without the technology, but in the physical realm, were the ones that, one, they started early, as we've heard, that's important. Also, you see a trend, other countries, different than the United States, they mandated the use of certain, like the apps that we're talking about. The United States, we have not done that. So states, as Lisa mentioned, states are kind of left to decide in terms of the technology tools, whether they're going to try to develop their own, maybe based on the Google Apple algorithms, or whether companies, they're going to hire out and have a company come in. And then the question remains is what kind of security procedures each state is going to mandate for the use of that technology. So we don't have, as a country, we don't have the best record. And part of it has to do with our culture, that we're not going to mandate certain things, right? We're not going to lock everybody down because in addition to contact tracing, you have to enforce quarantine, right? So there's a whole kind of package that goes together that tells you the story of what the United States is doing or not doing very well. But right now we don't have the best record compared to others globally and how we're carrying out contact tracing, including using apps.
I have this friend in the Netherlands who says, here in the Netherlands, we have very few rules and we follow them. You in the US have a lot of rules and you follow none of them. And I thought that was a pretty good insight. There's an audience question which plays right off this, Catherine. Why does the US seem to have such a strong aversion to a mandatory opt-in system for contact tracing? It seems like one more area where we are an outlier here, and not in a great way. That's a kind of a big philosophical question, but you want to take a stab at that one?
Yeah, I think if we want to think back as to who we are, when I talk about, I teach my students, I teach as a law classes, but I often remind them that when we think about the US government and our laws and where we came from, the history of our country matters. the way we are today and how we operate as a society really is dictated on how we began as a country. And certainly our laws in this country, as they were developed, were concerned about unlimited power left to the government. And we err on the side of making sure that we have our civil liberties protected effectively. We are very conscious and concerned. You know, the Europeans are very forward-leaning on privacy, probably more so than us. But this country also, we would not accept, I think, as a nation of individuals that really pride ourselves on our privacy, that if a government came in overly demanding and authoritative manners, meaning where with this, particularly with the apps, meaning that you have to opt in. You know, other countries that maybe have been more successful in the contact tracing and using the technologies is because they forced it upon people. Now, and it wasn't, it was an effect on your phone, it would be the default setting. So you would actually have to opt out of it. In the United States, it is the opposite, where you have to actually opt in. And so it gives individuals the ability and to not only think about it originally when you opt in, but many of the civil libertarians and privacy advocates have said, not only should the technology, whatever the states are going to implement and accept as, say, an app on the smartphone, not only should they give the individual the right to hold the data on the phone, which is what the Apple and Google technology allows, but they also, and not only allow the person to think about it and decide to opt in, but even once you opt in, that individual user should have the right to always opt out, meaning that it's not a one-time, because you might change your mind. You might decide, well, you know, I've been to a few locations that I'd rather not have certain app administrators knowing where I was and who I've been associating with. So I want to make sure I have the opportunity. So I think we as a nation are very conscious about who we're giving our private information over to. Now, one might not think about it with social media and our kind of engagement with apps and Google and Apple, but I think that's just what we're seeing today. I think it's reminiscent of our concern for our own personal privacy and security for our data, for our own information. I think hopefully that kind of in a philosophical way explains why we might not be doing as well as others in terms other countries, in fact.
Yeah, I don't see much of what you just said changing very quickly, by the way. Jason, let's talk about how, you know, let's talk about getting back to work, shall we? I mean, let's get the business school guy in here and weigh in on this. To what extent are companies doing contact tracing, using it as a means to get back into in-person business in offices and workplaces? And do you see it, and do many companies see it as an essential piece of the puzzle in order to get back to business?
Yeah, I'll build off Catherine's point about the decentralization here. It's really a company by company specific thing. I run an institute at the business school about the future of work, and that keeps me in routine contact with executives about topics that are on their mind these days with getting back to the workplace and how work might change in the future. And from my contacts, it seems that companies are taking two approaches here. Small companies are still relying on manual contact tracing. They're relying on employees to self-report any symptoms they may have. And they're trying to have some controls where they take temperatures of employees at the office door, or they ask employees not to take public transportation to and from work. They have sanitation stations around the office. Taking small measures like that seems to be typically what smaller businesses are doing. Then going back to Lisa's point about the use of technology, larger companies are turning to technology solutions, mostly because they have larger employee footprints or larger real estate footprints that they need to track. Generally, you do not see wearables like a Fitbit type of device being used. More frequently, you see companies turning to Wi-Fi networks. Anytime an employee logs in or uses their laptop, it's really easy to figure out when that employee has been in the office. Also badges, it's easy for a security badge to tell an organization which floor have you been on, when did you access a building, when did you access the parking lot. And of course, there's some of this Bluetooth technology that's going around, but it seems to be mostly Wi-Fi networks and badges. And then you merge that information together and you get a rough picture of which employees may have been on site and relatively close to each other at different points in time. But still, even that requires manual contact tracing. If you identify an employee who has symptoms or an employee who voluntarily says, I've tested positive for the virus, but I'm asymptomatic, it still requires the human resource department or other parts of the business to manually contact trace, just like we've heard the other panelists talk about. So getting back to work has been a challenge, and contact tracing is a central part of that. How to solve that? Some companies just try to solve it through the manual process. Other larger companies are trying to use technology, but even that involves a manual element as well.
It occurs to me as you speak, Jason, that those issues of privacy, which we were talking about a little bit earlier, are not as big a deal at the office. You don't have much of a presumption of privacy when you go to the office anyway. So does that make it easier for companies to basically impose these ideas upon people who might not want to opt in otherwise?
I mean, from the executives that I talked to, they seem to suggest that it's easier, but they're also concerned about employee and employment law. They're concerned about ADA laws as well, but they seem to give the impression that it's easier to do. One thing that I do not see companies doing, and perhaps there are some out there, is sharing this information with local health authorities. It really is an employee inside the office building contact tracing activity. It's not being shared outside of with the broader local community, which obviously would be helpful.
But companies are reluctant to do that because that might expose them to some liability, you think?
I think it's the privacy issue. The privacy inside the building is under the company's domain, but sharing that with folks outside of the building raises different issues.
Okay. Alexandra, another question from the audience. This is an interesting question. What's a contact? Is there a standard model for identifying a contact and defining relationships among contacts? With or without such a model, the question goes on, how are different collections of contact tracing data aggregated? So, I mean, if you brush by somebody on the street, that's not a contact. Define how, get under the hood a little bit on how this works.
Yeah, so there is some jurisdictional difference. So different public health officials will take slightly different approaches. And the idea is when you're asking these questions as a contact tracer, there's a degree of flexibility in what you're asking. And so it starts really in terms of the location and the intensity of exposure. So public transport's often a first point, is have you caught any public transport? And that then is because people tend to be inside for perhaps more than 15 minutes, which is kind of one of the indicators that's being used for COVID-19. With diseases that aren't respiratory illnesses, you might limit it to have you had direct contact, so situations where there may have been more direct exposure that could have facilitated transmission. So with COVID-19, it's really looking at those more higher risk, well not high risk, those moments of close intensity rather than, did you walk by anyone in the street? So, looking for locations that then help identify other people and circumstances such as, were you at work? Did people go to school? So those sorts of classifications. And again, different agencies will use a different range, but that's a general way of the contacts are being assessed, is really using this risk framework.
Lisa, let's talk another question from the audience relating to the apps. What is the expected timeline for the final release of technology being developed by Google and Apple regarding widespread use by public health officials? When is it expected that public health officials can actually use this data, especially since there are these concerns about privacy? And then I guess a related question, might as well throw this in with it. If the US cannot or will not mandate the use of apps designed for contact tracing, how useful in the end could this technology possibly be?
Okay, yeah. So, so the apps have already been released to states. So the technology exists at the level of the operating system of these phones, and very simple ways to.
And Lisa, I'm sorry, can I interrupt you, because I think that is a confusing point for people. You would imagine Google and Apple getting together and just releasing an app, and everybody gets to use the app, but they didn't do it this way to give the states some autonomy, right?
That's correct. That's correct. So that they wanted to do was they wanted to basically create the private layer to ensure that the privacy and the cryptography was there. And also the Bluetooth technology was working in a way that was consistent for apps to build above it. So this way it opens it up more to the states to think about their own restrictions and their own community settings to build the app the way they want. The problem is, as Catherine alluded to, and others have, the states don't have money to do this, and it's disorganized, and there's a lot of issues associated with trying to build that next layer. So now actually Google and Apple have come back and said, okay, let us help in some ways to build that. And it's not just them, there are a number of technology firms that are looking to help with that space. I think this comes down to one of the questions, or one of the statements you made early, Miles, which is trust. And if an app comes out from Google or Apple that works in every way we want it to work, would we trust it enough? Would the states trust it enough? And would we be able to audit it fast enough to ensure that it is as private as they may say it is? And so, the technology, I think, is not far. I think the technology is doable if we're willing to accept the terms and the conditions, and know that, yes, there is going to be some data that's there on our phone. Yes, it's going to be accessible for a certain amount of time, and then it's just going to go away. And if we can live with that, then I think the technologies are there. In other countries where the privacy restriction isn't as big a deal, these apps exist, and they're working, and they're actually helping with contact tracing, not necessarily as well as we might want, in the sense that the technology isn't precise enough sometimes about how close people are, how long they were together. And so that's still being worked through, but it's being used effectively, and it's in place. So here in our country, it's still important to develop this technology, even if we don't deploy it ourselves across the country, because I do think there will be universities that deploy a version of it. You know, MIT has a version of software that they've been developing that has had some issues, but may be very good to use in the future. And other different local communities could begin to work on this. If academic communities begin to work on this and release open apps, that might also help businesses start using them, and people may feel like that's a way to get at this technology. So we do want them to continue to build the technology, and we want to audit it. I think that's the key thing.
All right, Jason, this one came in for you. This is a kind of a provocative one on the issue of data harvested in the less private world of the office and exporting it out to the more private outside world. And the question is this: in the same way that private companies can use genetic testing results have been used by the police, that a private, so in other words, 23andMe is what they're referring to, that kind of thing, use that kind of data to solve cold cases, or how companies can observe laptop usage now in the home during remote work modes. What would stop this data from being used to locate witnesses, participants, or people who are near or involved in accidents, crimes, or other illicit activities that need public location information to solve? That's the sticky one, isn't it?
I mean, if you want a provocative answer, I would say there's very little from preventing that. Companies already read your emails. When you use the corporate email system, whether you know it or not, you've agreed for the organization to keep those for perpetuity and read those and use them in investigations, and they can be used in the prosecution of different types of corporate crime. I see little reason to think that an organization wouldn't use location data in a similar way to at least establish that somebody was in the building at particular times of day. Now, whether the police could get that information from the organization would remain to be seen. I'm not an expert on that dimension, but companies would certainly not hesitate to use that information potentially to their advantage, even if it's just for improvements in marketing or data sharing between organizations. I can see that as being a possibility, absolutely.
So Catherine, does this take the whole Netflix, Amazon experience to another level? Is this a Minority Report scenario where we're walking around and everything we see in our life is tailored to us, the advertisements, the messages? There's a certain creepy Big Brother component here that everybody's worried about. How real is it?
I think in terms of the Big Brother concern, that's why most of the advocates for the technology to kind of support the physical contact tracing, because I don't think anyone thinks it's going to be the app fixes all of this, but that it only complements the human contact tracing. But those that advocate for the use of that, a part of the privacy advocates, what they're saying is, we don't want this data to be held by the government. And most say not even the public health officials. And this is why I think the Apple Google solution was attractive, in that they put a lot of effort and were very conscious on the front end of the privacy issues. And I've heard some of the non-privacy advocates, or those that would take the opposing view, saying they did that too much, where it's kind of handicapped and made it more difficult for the health public officials to get immediate access. But given what they did, they put the privacy on the front end, and they said this data is not going to reside. Well, it's encrypted, and it's opt-in. It's got to be consensual, but the data will not reside on a public health official's server. It's going to be in the user's phone, right? That you'll have some control over that. Now, that doesn't prevent any kind of leakage or hacking in to someone's phone and getting that information from adversaries, right? So I think there's a concern of Big Brother, but there's, I think even more so, which is given less attention to, there's got to be concern of our foreign adversaries as well. So it's not just our government. There are risks in place, like any technology, especially when it's developed under a crisis, which we're in today, where there's companies, in addition to Apple and Google, but many other companies that are rushing out to develop this technology, and they haven't tested it sufficiently enough. There are going to be flaws. And so what Lisa mentioned, we need really strong third-party auditing of this. We need penetration testing to make sure we find the holes. But the concern is there are going to be adversaries, other countries that are going to love this in terms of it's a rich target. And you want to try to minimize the attack surface by having this as diversified, not keeping the data in one place. But most people would say, I'm concerned about Big Brother, and I certainly don't want the government to get access to this information. In fact, they didn't. This is what was there was a lot of pressure on Apple and Google and other companies to basically publish their security practices. Aside from the open source code that they want people to test, they said, we want all these companies that are developing these apps to publish their security practices, including having them agree that if the big government comes to you later on and starts demanding this information, that you're not going to change your policy, that you're not going to be giving this out. Now, but, it's hard, as Jason said, there may be, if the information resides somewhere inside a company, that the government, local state officials, if they have the legal authority to get access, a company is not going to be able to deny that. With a warrant, if you have that data, unless you want to try to spend money and go to court, likely the government is going to, if they have the legal authority and a criminal warrant, to get access to the data. So that even with secure technology, even if we've resolved the capability of the technology to maintain it on a user's phone and encrypted, even if we minimize the leakage, we're still going to have to deal with this data being existing and potentially legal authority for the government to get access to that data. And I think there's certain communities that are very conscious of those possibilities that are kind of less likely to use the applications. In fact, if you think about the immigrants in this country, or those communities that are more concerned with their rights vis-a-vis government officials or the police, they're probably going to be the ones that will, never use this this technology. So yeah, there's truly a concern for Big Brother in this story, and I think that's why the companies working on the technology have tried to put that front and center and at least minimize or address those concerns. And Lisa has mentioned some of the things like sunset clauses, getting rid of the data after a certain period, things like that.
Miles, can I say one thing?
Go ahead, Lisa. Dive in. Go ahead.
I know everyone's worried about our data being saved and held onto, but every major corporation that we interact our apps with has all of our data and can.
The horse is way out of the barn, isn't it?
I mean, we live in this world where we think, oh my gosh, my data, it's just mine and nobody has it. People are on social media. People keep their devices with them all the time. They keep it with app location, they keep it with location services on. They do all kinds of things where they're sharing data that's easily linkable to make a huge profile of them from just their publicly available data. And we're worried about one piece of data that might actually help save our country from, more deaths at a rapid rate, right? So we really need to think about this and balance this and think about what parts of privacy we're most concerned about. If we have good encryption technologies and we're holding companies to using these good encryption technologies, that's good, that's progress, and that's the way we should be doing it.
Well, I think there's an argument to be made that in this country we've sort of forgotten the value of the common good. We are individualists to a fault in some ways. That would be my personal opinion on this one. Alexandra, question from the audience on this, which is right on point on this one. Does it always make sense to sacrifice knowledge of the circumstances and context of transmission for exposure notification at an individual level? In other words, does the end justify the means? If somebody is exposed, is it worth exposing somebody's privacy in order to help that person out if that becomes necessary?
So public health has always had this, it's got the power of the state behind it. It is state power in the United States that is where public health authorities get their ability to conduct surveillance and conduct investigations. And I think it's generally well established that because of the potential health risk and because of the broader risk to the public and to other people, that there is a justifiable role for government. But this isn't paternalism. This is, this is your classic mill philosophical question, is that when you start to do harm to others, that's when there is a legitimate justification for regulation. And we have over 100 years of US legal and constitutional law on these particular issues of where government regulation to protect the public's health is quite legitimate. And I think this sort of ties in also to the point that Lisa was just making then, that you made then, Miles, is that there has been a weakening in the value of health in the United States in terms of the common health, and I think part of it is perhaps a perception, not reality, of the individualism of the United States. And I say that perhaps as a foreigner who, my experience and observations here is that's often spoken about, but really that there is this collective good in certain circumstances, and it comes down to how leaders are framing what is important and what is valued. So a great example is the freedoms that we could debate Americans give up going through TSA whenever they want to fly, or when we go back to flying in the future. Right now, we have the equivalent on average of 2 747s of Americans dying every day. And yet we're having debates about contact tracing apps or the legitimacy of the sorts of information you give up in contact tracing. And so I think there really needs to be a reframing by leadership that there is something fundamentally American about caring about each other, that there is a collective movement towards things that can be to be accepted, and that health really needs to be revalued and recentered in that discussion. And for me, that starts with, not just public health for this outbreak, but things like re-establishing universal health coverage in the United States.
I have a question here. I'm not exactly sure who wants to take this. Maybe it's you, Alexandra, but if anybody else wants to weigh in, this is from an old friend. Hello, Annalisa. Thank you for being here. Can the panelists comment on how many people would need to opt in to make the app, contact tracing truly effective? Virginia, she says, reached about 500,000, but they said they needed a minimum of 2 million in that state for the app to function, 2 million contacts, I guess. What's the best way to quantify that? I mean, when we start thinking about one state and 2 million and all the problems we've just laid out, the idea of making this truly effective on a national level seems like a tall order. I guess, Alexandra, you want to start with that? Then we can go on if anybody wants to weigh in.
So I might defer to the other panelists on that one because the scale is out of my expertise.
Okay, do you want to take the scale issue, Lisa or Catherine or Jason for that matter?
I've read a couple of studies. I can give you the numbers I've read. I mean, and they're never exact. It's varied. If you look at the whole population of the US, and for any country, they're saying anywhere between 50, I've seen these numbers, 50% to 75% of the population would have to opt in order to have effective use of these apps. Now, I also, though, was listening to a podcast, but it was, I guess, back in April, a former FDA official was on the podcast talking about contact tracing. He said to that point, he had quoted on the, I think he had said the 50%. I've seen, though, like I said, any as high as 75% by some officials. But his point was, listen, I've heard that 50% of the people have to opt in to make it effective. However, in his view, even if you have 10% of the population opting in, it's better. Meaning and it made sense that, listen, you're not, the more, the better, but at least if you get a certain, his bottom line was 10%. I don't know how he came up with that, but in his opinion, and he had worked, I think he actually said he had worked on the Ebola outbreak in Liberia. So from his personal experience in dealing with this, he thought even a 10% opt-in and use of the app would be helpful. So in my view, I think now that those numbers don't really help us, anywhere from 10%, some say all the way up to 75. That's a big, big. But one thing I want to say, because I was very fascinated by, and I believe it was South Korea who did this. So they've been having, they're one of the kind of countries that have been identified as using contact tracing and having it being effective, and not so much just the app, but also a combination of the physical contact tracers and the app. And when I read what they were doing, I said, well, why wouldn't the US be doing this? What they did, and people who have in the studies said that this has kind of been part of the success, not only were the physical contact tracers going out and doing what they normally do, they were also, in addition to talking about symptoms, they offered specific help, meaning they offered people that were in communities where if you were told to quarantine for 14 days, you're going to lose your job and this is not going to be viable. You have to have a paycheck. But what South Korea, the government did, is they funded these services, including like money. So you would get a paycheck. They offered, food. They offered even isolated housing for these people if they didn't live in a place that they could be isolated from others. And I said, I tried to look, and I might just not have found anything. I tried to figure out if any state in the United States, if that's happening with the contact, not only are the contact traces going out, but are we offering people in communities specifically that need that money and food? Are they getting, like, I think in South Korea, they were getting 2 meals delivered. Those that were required to quarantine, 2 meals a day. And I couldn't find, but it made complete sense to me that this would be useful and helpful for people to kind of be cooperating, but aside from the app.
And I think this goes to the fundamentals when we talk about, say, ethical quarantine. These are fundamental things that we've got in our pandemic preparedness plans here in the United States for influenza. These are things we've discussed. And I think, what is quite shocking that we're now in September and these really fundamental questions are still not being implemented. And I guess the challenge is now the scale that we have now in the United States, that being able to implement these, basic, what is an ethical quarantine is now sort of has the horse bolted, or do we have a chance to sort of reset the response?
So here's one more. I'm not exactly sure who wants to take this one. This person says, I have a very common name. This person gets calls and emails for the wrong people frequently. And while this person was a student at Georgetown, one time the DC police even showed up for the wrong person. That's not fun. If a contact tracer reached out to me, what information would they be allowed to share that would help me believe that they had reached out to the right person? That's an interesting one, because you could ultimately be revealing somebody's identity in order to verify the identity of the contact tracer. Otherwise, you could imagine this would be presumed to be, phishing for your social security number, your credit card number. So anybody want to take that one?
So I'm happy to jump in. I mean, I think the CDC has been trying to share information with people of what contact tracers will not ask for. They will not ask for money or social security number and things like that because of concerns about these specific issues. I think when you think about the public health rationale of contact tracing, really the point is to alert that person that they could potentially be at risk. And so if you have, say, a false positive, that is, you identify an individual who isn't actually a legitimate contact, what are the potential harms from that? Well, the harm for that person who's been contacted is that potentially they couldn't go to work and they couldn't be quarantined. They would have to quarantine. So that could be quite significant in many cases. And I think that's where these points that Catherine was making about ensuring that there are these other forms of support is really critical to, in fact, capture these sorts of gaps. In terms of the information they would be providing, they wouldn't be providing the individual's identity of the patient, but they would say, we believe that you may have been on this bus, or that you were at this restaurant, and it would be generally location based, typically, or you're at this school, and that that might be sufficient. And I think one of the challenges that's been identified is people not wanting to then comply, even if they do appear to have been in contact, which is a whole nother issue about compulsory quarantines and things like that.
We're about out of time, but Jason, I want to get you in here with a final thought here. What this is kind of boiled down to is a struggle between personal privacy and the war against the virus itself. This is an ongoing struggle here. To what extent do you see it as crucial for us to all get back to business, whatever that may be, whether it's going to school or going to work or just living our lives? To what extent is it important that we sort of rethink our perceptions of where we draw the lines on privacy in order to allow us to effectively fight the pandemic using tools like this? Is it essential?
I mean, I think it's absolutely essential in order to be able to get large number of people back into the office working closely together. And just as a final thought, I'll leave the discussion. What do you think is going to happen when a vaccine is available and people decide not to take it? Are employers or organizations going to be able to require people to have proof of the vaccine before they're allowed back into the office or back into school or perhaps onto campus? And I think that we're going to see a rehashing of the same discussion we're having here about contact tracing when we get to that stage of the process as well. So my final thought is more of a forward-looking one.
All right, I think you set us up for a sequel there, Jason. I think that'll be webinar part 2 when the time comes. We look forward to the day when we can discuss how we're going to handle a safe and effective vaccine. And it's amazing how quickly that's been going. And that's a whole other fascinating story in all this. Panelists, you've been great. Alexandra, Lisa, Catherine, Jason, thank you so much for shedding some light on this. It's hard to tackle something as complex as this in an hour, but I think we did a fairly good job at least getting people thinking about this, and we'll hopefully continue the discussion online and elsewhere. Thank you for your time, and thank you to the audience for joining us. We appreciate it, and Hoya Saxa. Have a good day.